woman. This is the Church of Pentecost USA Radio, COPUSA Radio. And Elder Sam at the studio, God bless you for all you do always. And thank you all who are tuned in and those who are watching us from Facebook. Today we have young women with us today. They are all in the medical field. And we know that October is the Breast Cancer Awareness Month. It's a month that has been set aside and it dates way back to somewhere in 1985, where in the US, breast cancer awareness was made a huge thing, and it's needed to be made huge because breast cancer is very prevalent and one of the leading diagnosed cancers in women. And so today I have with me Mrs. Afua Acheampong. She is married to Elder Justice Acheampong of Charlotte District. We also have her as a physician assistant. She works in family medicine and urgent care. That's her specialty. And she is very much involved with the Youth and Pension Ministry. She is a recent mother of a 7-month-old boy. You are welcome, Mrs. Afua Acheampong.
Thank you.
All right. And we also have with us another young person, Mrs. Priscilla Tutu-Mensah, is a senior medical student who is looking forward to graduation next year. And she will be starting her residency in family medicine with a concentration in women's health. So it's so good that she's with us here on Today's Woman. She currently is in New York and she is in the Queens District, very much involved with the Youth and Pension Ministry. And Mrs. Tutu-Mensah is the daughter of Mrs. Joanna J. She used to be the Greensboro District Women's Leader, and she's part of the Atlanta Regional Women's Ministry. So these are all Church of Pentecost babies. You are both welcome to Today's Woman. So we are going to have fun, but we are going to talk about serious issues today. We are talking about breast cancer. Could you, let people know why it's very important that we are talking about breast cancer just right at the border of October?
Yep. Afua, you want to take this or do you?
Go ahead.
Go ahead.
Okay, so yeah, breast cancer, like you said, Mommy, is like the leading diagnoses in women today. It's important that people know when to start screening, who to go to when they need to be screened. Because although the mortality rate, like the deaths over the year have decreased, the incidence of it or the prevalence has been increasing. So what we want to do is prevention. So we want to minimize like how serious it can get. So if we get it screened early, then we can catch it earlier, we can treat it, and possibly go into remission. So that's what the month of October is all about. It's all about getting people to be screened and getting to know actually their breasts, because most people should. Something that we don't teach is how to do a breast exam on yourself. So
yeah. And then also to add to that, with the prevalence of it also, even though breast cancer is diagnosed more in other races, Caucasian women and other races, African American women die from it more. And that is because, we're not going in for screening when we're supposed to. So their disease is not being caught as early as the other races. So it's a very important topic for us to talk about, especially, with October coming up.
And actually going off of that, like, there's also something like access to care, people who don't have insurance, there's actually like programs set aside to provide you free screening as well. So it shouldn't matter whether you have insurance, whether you don't, you should also be screened. And there are programs out there that would allow you to get screened. So ask your doctor when you go in.
That's very true, and that's very great. And talking about just doing personal screening, this is something that we as women can just make up our minds to do it because we have the monthly, things that we so that could be a very important time that you could personally do your own self exam. And it doesn't take that much to do. And it's just one of the good things, like you said, it helps you to know yourself, know your own breast, and be able to detect if something is out of place. And that can be a very, very fundamental step in actually catching it on time. Now, talking about the screening, I've gone through it and it's not comfortable. But we have to be proactive about our own health because it's better to get to know it. And in as much as it seems like the prevalence is more now, it's because, like we were saying before, that it's because more people are now aware because of the, all the teaching and education that is going around, and it's making more people just take a second look at it, and it's much, much beneficial now than maybe decades ago. So that's very good. Now, the question to ask is the breast cancer only in women?
Go ahead if yeah.
No, although it is more common in women, men also get breast cancer because men do have breasts too. It might not, be as big as ours, but
Yeah.
there is about a 1% diagnosis rate in men as well.
Mm-hmm.
Right.
And actually there's when you find breast cancer in a man is
Right.
more deadlier or
Right.
more serious than it is in a woman. So
That's
that's
very true.
something that should also be screened and should also be an awareness thing as well.
It's true. I know the emphasis has been on women because, of course, we have the prevalence and all that. But it comes as a shock to men. It's like, yes, there's breast cancer in men as well. But of course, it's more in women. We know that, but it needed to be said. So let's go into what makes us prone as women to breast cancer. Why is it so prevalent amongst us as women? So Mrs. Tutu, why do you think that it's more in men, although there's a 1% chance in men versus women?
Yeah, so in women, okay, so the first one is we have more breast tissue in general. And we have this hormone that we call estrogen, which is what makes us who we are as women. And the more you are exposed to this hormone in length of time, so from the period you have, from the time you have your
Yeah,
first
yeah,
your
you
first
got it.
menses, right, to the time you um, have menopause, that length of time is all part of the time that you're exposed to estrogen. So the longer you are exposed to it, the higher the likelihood is. Also, if you have a family history of breast cancer, that could also increase your risk. There's also, but with the family history, it has to be in a first degree relative. So that is a mother, a sister, a brother, um, something like that. Um, what else?
I think you can jump in.
Yeah,
Um,
if you
if
feel
you're, yeah.
sure.
Right. And so, just like Priscilla said, also the older you get, the more chances of you getting, breast cancer because, you know, what were you gonna say?
I just remember alcohol also.
Yeah. Yeah. Well, great thing is we are the Church of Pentecost Radio. We don't deal with alcohol, but of
Right?
course, we have to tell the others that
Right.
hey, stay away
Yeah.
from the bottle. But you're
Right.
right. Yeah.
Stay away because it's one thing that has been linked
Mhm.
with an increase, like a proportional link between the prevalence of breast cancer and the amount of alcohol that you drink. So, yeah, that's one thing as well.
All right. So back to you, Mrs. Acheampong. I think you were.
Yeah, so I was gonna say she's done a pretty good job about speaking about the risk factors, but I was gonna say, the longer you live, the more chances of getting it as well, because you're alive longer, you know, genetic mutations are happening, every day we live. So that also predisposes you to the chances of being diagnosed.
Yeah. And talking about, the first family relations, most of the time, if you have cultures that are very secretive, that keep things from, the family, then it becomes very difficult for you to even know that you were supposed to, such things being part of the gene of the family. But it's good to have that conversation where we are not hiding, because it gives you a chance to take very greater proactive steps if you know that in the family there's that. Because I know that sometimes when you're given those things to, fill the forms, it's like, oh, whoa, all these things, I don't know. And it's because we are not having that conversation. But because we know that there's a greater chance of survival once you get to know, these conversations need to be had where you know what is in the family so you can deal with it. I just want to acknowledge some people who are with us. I see constant. She's very constant with us. I see dear one, Louise Jackson Henry's with us. She says, good afternoon to you, or good afternoon to you too, and thank you for being with us. And we see Elder Ransford Damte is watching. Hey. Thank you. And there are other people that are tuned in with us, and we want to say thank you all for being with us. So we're gonna go and just continue to talk about breast cancer. What are some of the things that also, in as much as we know that age and alcohol and just being exposed to a family member, the very first relationship, mother, brother, yes, because we want to throw in the brother facts that some we just like women and breast cancer, but today we also want to throw in them, and those people also predispose to. What are some of the things that are the protective factors, the things that can be something that, so we know the bad side or what it is, what can protect us from breast cancer?
Yeah, first time mom should talk about this.
So some of the protective factors, or some of the things that reduces your risk of it, is having children early, believe it or not. So if you have children, before the age of 20, which, I mean, it's not really realistic looking at today's world, but having children early definitely reduces your risk. If somebody was to have their first child at the age, under 20 or right around 20, versus someone who has, children after they're 30, that definitely reduces your risk, not to hone in on the whole biological clock, but it does really tick. So that is one thing to keep in mind. Also for people, and I don't think even though we as women, we have this love-hate relationship with our periods. Actually, having your period later in life, it's also a protective factor, because like Priscilla was saying, estrogen is what makes us women. So reducing the length of time that you are, exposed to it. And then going into menopause early, even though, everything has its, pros and cons, but I think that if you had to deal with the symptoms of menopause versus the chances of cancer, I'm sure everybody would choose, otherwise. So those are some of the things that can be protective factors against your risk of being diagnosed.
As well as breastfeeding.
Right. Oh, yes.
Yeah.
So,
Yeah.
Yeah,
but sometimes we want to run away from breastfeeding. But there's some wisdom in God's creation and God's natural things that He set in place. If you can help it, sometimes it's not doable. Some of the kids will not do it. Sometimes certain medical things restrict you. But all things being equal, if we're able, it's good to know that just breastfeeding is a protective mechanism for us when it comes to breast cancer.
Yeah, and
sorry.
You don't necessarily have. You could pump and then feed the baby with the bottle as well if you don't, because some mothers don't want to breastfeed, or there's actually a trend in the hospital, like you will ask mothers like, or do you want to breastfeed? And they're like, no, I don't want to. And we're like trying to convince them like, please do, because it helps with the weight loss. It helps with breast cancer. It helps with everything. And that's how your body goes back into what it used to be, actually.
Yeah. And then also, we don't like to talk about this, but I just, having more children. So there's a protective factor. So, yeah.
That's good. That's good to know. And let's ask this question because we are spiritual. Is breast cancer spiritual? I'm gonna go read. I'm, I'm gonna go read a scripture in 3 John. It says 3 John 2, beloved, I pray that you may prosper in all things and be in health just as your soul prospers. So, the word of God has assured us that we'll be in health, and so sometimes there's that question of, well, is it spiritual? But because we are spiritual beings, then we're going to say, well, it doesn't matter whether it's coming from a spiritual source or things are not in sync with us. We do believe that there's healing with God. So eat into that with me. What do you think, coming from the medical perspective?
From the medical perspective, I think there is. I mean, me being a Christian, also seeing like, there's answers that there's sometimes we don't, as medical people, we don't have an answer. There's patients with no family history, like all these risk factors that we've listed, like sometimes they don't have them. They could be the healthiest person, but then they still get the breast cancer. So in things like that, then, there's definitely has to be a spiritual aspect, in my opinion.
Were you going to weigh in on that, Mrs. Acheampong?
I would say so. I would say that, of course, like as Christians, we believe in divine healing, God giving us answers to things that medicine cannot answer. But I would also approach it in a different perspective, because sometimes I see patients, you tell them, oh, it's time for your mammogram. And they're like, well, I don't claim that, and then they kind of offhand brush it off. But I also believe that it's important that, even more so as Christians, that we take care of our bodies. So God has given us all of these options and given people the knowledge and the wisdom to come up with things like this. So I think that more so as Christians, not that you're living in fear and anxiety, but that you make it a point more so to check, to get the screening that is necessary, to follow guidelines, because, God has made it available for us to use it. So that's kind of what I would say on the whether it's spiritual or not.
All right. Priscilla, you wanted to say
yeah. I also think, God has given us dominion over all things, right? So that means taking responsibility of everything that is in our lives, including our bodies. So paying attention, like we said earlier, to our bodies is also something, that goes hand in hand with like what Afua is saying. And it has like, you pay attention, you pray to God. And I believe that God is able to heal, So even if you are diagnosed with such a thing as breast cancer, then I do believe that God in his divine wisdom can heal you if we approach him. But we also have to, like Afua said, we have to take responsibility of our health as well.
Which is very true. And, talking about a person who says, I do not claim this, going to have it tested doesn't mean you claim it. But, we just want to seek, help. And as a church, even as a Church of Pentecost, we also believe in divine healing, but we also have a stance that says that we also believe in physical healing. And so as a church, we have a statement that we have put out there that says we believe that the healing of sickness and disease is provided for God's people in the atonement. And so there's nothing that prohibits us from actually seeking medical help and diagnosing something early as breast cancer cancer gives you a higher chance of survival, a higher chance of treatment. But just going to have it tested does not say that you are asking for it or you're calling it for it. But I can see where somebody says, "Oh, this is a spiritual disease," because the Bible says in Exodus that God says, "I'm the God that heals your diseases. So why should I have it tested?" But He also heals. So you go into the Bible, Jesus healed a lot of people. Jesus raised the dead and all that. So sometimes this body will fail us, but because we are spiritual people, that's when once we know what we are dealing with, then we go to God in prayer. So we can pray to prevent it, but once it's here, we can also pray to be healed. And so that's the balance for us. So that's very great that even if there's a spiritual dimension, we are spiritual people and we will take the spiritual measures to avert that. So let's look at the screening, talk about that. Those who just say, I'm not going to go get screened so that I don't call it for myself. But having a screen also, we already talked about the discomfort of the mammogram, but just encouraging ourselves to go through it. So let's look at other testing, things that can be used to test to determine the breast cancer disease.
Mhm. I think one of the ones we've mentioned or we've kind of touched on it briefly in terms of something that you can do yourself. And even, when we talked a little bit about so the self breast exam, right? So even though guidelines actually say not to do self breast exam, I think that it's, important that women know their bodies and know their breasts. But with that saying also goes knowing how to do it appropriately so that, you're not getting anxious or, getting scared at the first thing that you see or changes in the breast tissue that may be normal that, might not feel so normal to touch compared to the rest of the breast. So definitely self breast exam is something that you could do. And then if you're someone that does not like, there are people that say, I don't really know about touching myself and things like that. And I think that culturally, especially the older generation is, like that. So even making sure that you get your annual physical exam and then letting the doctor do it while you're there is, important. So even though some people might be, some medical personnel might be moving away from that, it's something that you can definitely ask for if you're not doing this monthly. So I think that the self breast exam is a very important aspect of, early detection and seeking early medical care and things like that.
Very true. Very true. Very true. Very true. I'm gonna acknowledge our people, and there's a question out there that I'm needing to ask so that we can look into that. So we have Auntie Gertrude Jima with us. She says, "Good afternoon. This very important topic. Thank you." We have another person, Stephen Osen Anand. Thank you, sir, for joining in, and Beth A.N.G. Thank you, dear. We have another person, Christian A.K. Kofi is watching. God bless you. Betha says, I'm watching too. Yes, ma'am, we know. Auntie Grace Jiman is on there. God bless you. And we have Reverend Francis Kruma also is watching. God bless you, sir. So there's the statement that UC Berkeley and Lawrence Berkeley National Laboratory study has found that mechanical force can stop the rapid growth of cancer cells as well as guide them back to a normal. And the question says, healthy growth pattern question, does squeezing of the breast prevent cancer because of the link to the mechanical force? Is it clear? So the person's question is coming with the fact that they are saying that mechanical force prevents breast cancer. So does squeezing of the breast prevent breast cancer?
So there's a two-part, I guess. So mechanical, it depends. So if you cause trauma to the breast tissue, that could potentially develop into, it causes the breast tissue to scar, and then out of that, it could lead to irregular cell growth of the breast tissue, which can also lead to cancer. But it has to be, and I think when it comes to that research, the mechanical force that is applied to the breast has to be done by a specialist or someone who is well trained in that methodology, because there's a fine line between the force applied to cause good to the breast tissue, and there's a fine line between causing trauma to the breast tissue that can lead to irregular growth.
Exactly, because think about squeezing, and there's just a fine line, like you said, between a professional doing what is measured and accurate than just any other person doing it. So you would need to deal with a professional who knows what they are doing versus just, I can, because I can see something coming out of here where people will start taking advantage. And if husbands are listening, then wives are in trouble, because then here it's like, oh yeah, we're gonna be curing you. There has to be a fine line as to what we mean by squeezing. But that is a good one. Thank you, and keep the questions coming. All right, so I think we're still talking about screening and how these things are helping. And the BRCA testing, let's look into that. How relevant it is, because I know that some insurance will not outright, they will not cover it. It's a very expensive test, and there is a 50-50, and some people are for it, some people are against it. So let's look at that in relation to cancer screening.
Yeah, so age plays a very important role when it comes to like deciding when to do the screening.
Okay.
So I'm gonna make it into scenarios. Mm-hmm. So if let's say a patient presents to the office and they're less than 30 years old, and they tell me that, oh, I feel a lump in my breast or something doesn't feel right. So as a medical practitioner, I'm going to order an ultrasound first. My first step would not be a mammogram for that particular patient, because younger patients tend to have denser breast. Mm-hmm. And most lumps that are found in patients of that age are benign. So they don't have any malignancy associated with it. So we always start with a ultrasound. Now, if the person is older than 30, then I start asking myself, do you have a family history? Do you have any of these risk factors that we discussed earlier? And if they do have the BRCA gene, or if they have a family history, then I might recommend them to mammogram, but that wouldn't be my first step. I would also send them to get an ultrasound. And if something abnormal comes from the ultrasound, then we would do a mammogram. But mammogram testing in general for the general population starts at the age of 50. Now, there's two schools of thoughts. There's the United States Postal Task Force, who is for the 50 year. And there's the National Breast Cancer Association, which recommends an earlier screening. But we can see why they would recommend an earlier screening, because they are focused on the breast cancer itself. They're a cancer society, so they would push for an earlier screening. Mm-hmm. So then that leaves a lot of room to the discretion of the provider and the patient as well. But definitely at the age 45 and above, you can definitely start screening. And around those times, then the insurance will cover it, as long as it's a yearly thing or a biannual thing.
Mm-hmm. That's good to know. That's good to know, because sometimes when you hear people throwing the names of tests around, it's like, oh, I need to have that. I need to have that. But the relevance of it, even in helping you determine it and all that, is very good, especially also so you avoid dealing with insurance issues. So now let's look at treatment. Because most people also, as we've established earlier, do not want to have it tested because I don't want to know. And sometimes we think ignorance is bliss, but it's not when you're dealing with a kind of disease that deals with a better chance of recovery or better prognosis if it's detected earlier on in life. And so it's good that we're having this conversation. So let's look at treatment. What are the treatment options out there if somebody is diagnosed with breast cancer? I know one of the things that's a major issue for most people is, can I live with the loss of a breast? So let's look at treatment options out there and how it affects the well-being of the individual.
Um, I think there are, just like with any disease process, there are different types of treatment modalities, but that goes back to the stage at which the cancer was found. So, you know, one patient might be treated with, let's say radiation. Another person might be recommended for mastectomy. Or would it be, medication, things like that? Or is it a combination of, any of the modalities? That pretty much depends on what stage and the type of breast cancer diagnosed, the qualities of, your cancer cells, and how old you are. Is the patient able to tolerate one treatment modality versus the other? How aggressive do we want to be in terms of treating this patient, taking into consideration the quality of life? So I think that is very tailored to what patient dynamics. So there is not an overall, okay, this is how we treat breast cancer. I don't know if Priscilla has anything to add to that.
Yeah, I think, it depends. It goes case by case. So usually, like if a patient comes in and they have against this lump in their breast, and it's after imaging and everything that is done, we find that it's confined to a certain place in the breast, then we can just remove that that abnormal growth in the tissue. So that procedure is called a lumpectomy. So that's when we're just removing that part. And then the person can go about their business, or we can also do the mastectomy, but those are two. Is divided into like a radical mastectomy, which is like the removal of like all breast tissue and everything. So living without a breast, like you said, or it could just remove a greater amount of breast tissue, but then it also causes the breast to look deformed. But we have reconstructive surgery as well. So if a patient does not necessarily want to live without their breast, they do want that a greater amount of breast tissue. Oh, sorry. if they want to have that appearance, then that could also be an option. They can undergo reconstructive surgery and we can fix the shape of the breast.
All right. So there's a question out there from our elder Samuel, and he says, when it comes to treatment, which of these is most effective? Chemotherapy, radiation, or surgery? Because I know we are saying that normally it has to do with a case-by-case basis, but is one better than the other in a specific case?
So no, because it depends on how advanced the cancer is. So if the breast cancer is localized to, it hasn't spread or what we call metastasized to other parts of the breast tissue or any
other organ,
lymph nodes, then a more targeted approach would be more necessary. So that's when the lumpectomy and maybe not the radical mastectomy would be more beneficial. But when there is metastasis, when there is outside, like when the cancer has gone outside of the breast, that is when we want a more like systemic treatment. So that is the chemotherapy, that is the radiation can just target that that tissue and then shrink it, and then you can do chemotherapy for the systemic treatment of the cancer to stop it from spreading.
That is
And
very good to put it. Yes, please go ahead.
I was gonna say, and also, to go along with that, and to kind of echo what Priscilla said, no treatment modality is really more superior over the other. That is why in some patients, there might even be a combination of, the available therapies that are used. Somebody might undergo a lumpectomy, but depending on the shape of the tumor, it might be very easy, or like, let's say, for lack of a better word, a regular shape where they can really go in and take it out and have, a lot of tissue to even take a greater portion of that area of the breast and kind of go take out. So normally when they do like a lumpectomy, removing the tumor, they will also take more of the good breast tissue surrounding it to make sure that they really got all of the cancerous cells out. Or sometimes, depending on the shape of the tumor, they might take as much as they can and then recommend that the person also undergoes maybe, radiation with chemo, whatever it might be. So, one treatment modality really is not superior over the other. It all goes back to, the stage of the cancer and, how well the patient will tolerate, the treatment modalities out there.
Mm-hmm. All right. So let's also look into another question that we have, and it says, this topic is great, and thank you, Priscilla and Afua, for discussing this. My question is, how do we break away from the fear of reaching out once diagnosed with not just breast cancer, but any kind of cancer? Like we were talking about, people who are afraid. Some say they're not claiming this. That's why they're not going to get even the screening or the test done. But once there's the diagnosis, the next step to go.
Yeah, I think so. Mostly when any diagnosis in general, once we receive that diagnosis, what sets in is fear, right? Fear of not knowing what the future or what the outcome of this diagnosis is going to have on my life. So the Bible says, for the lack of knowledge, my people perish, right?
Yeah.
So I believe that once you receive a diagnosis, yes, there's that moment of the crippling fear of not knowing what to do, how to do it. Like, what does this even mean? So what is beneficial is talking to your provider. Like, what does this diagnosis mean for me? What are my options? What can I do? In the meantime, as we wait for all these tests to come back, what can I do? So being informed and actually knowing what it is that you are being diagnosed with, even if it's not breast cancer, it has that relieving factor. It releases you from the fear of that cripples you and prevents you from not going to the doctor. Because I know most of the patients, the first thing they're saying, oh, I'm going to die anyway. So why speed up the process, right? So we always have to spend time and be like, you're speeding up the process by not coming to us and by not having us help you out. So in conjunction with that, in conjunction with prayer, so I think being more aware of what your diagnosis is and being informed and educated.
And to chip in with what Priscilla said in terms of, reaching out, I think that, like Priscilla said, when you get a diagnosis like that, regardless of who you are, there is that fear aspect. And I think that reaching out is especially important in that instance, because, the person that is receiving the diagnosis, if let's say you have your ministers or someone that you trust, that you can tell it to, who will have better reasoning, because when you're afraid in that instance, you're not really thinking straight. So talking to someone, not just to tell them, I think is really important, and who you reach out to in that instance as well. So that you're not sharing information just to share information, but that you're picking someone who can help you see reason, someone who can speak words of faith into your life at that moment, and even get you to get rid of that fear and really, boost your faith in that instance. So picking someone that you can talk to, and then of course talking to your provider, like Priscilla said, so that you're armed with information, but you're armed with, you can only battle when you have all the facts, as much of the facts as you can have, because nobody really knows the outcome except God. But if you're reaching out in terms of, okay, I'm going to go to God, well, then you have the medical aspect, you have all your medical information, and then you're bringing it to, God, your superiority, who knows the entirety of your life. So I think that reaching out to someone that that is going to make a difference, not more so to tell someone just to tell them, but picking someone who can stand with you in prayer, someone who in that instance can tell you, can remind you of what God's word says. So that's the little that I was saying that aspect.
That is very good to know that we are doing both the physical with the spiritual, because there's God, and God is the God of peace. So even in this, because at this point you don't even know the prognosis is, but God's word gives you hope, it gives you peace, because He's the healer of diseases. And sometimes at that point you are weak, so that's where your spiritual family, your pastor, your ministers can stand in for you. And also there is a lot of research out there that even shows the family support helps because of the emotional well-being. So just keeping it alone in itself is a heavy weight. But a good thing you said is just not sharing it for sharing's sake, because some people are more afraid than you are. So if you share it with them, they will make it seem worse than it actually is. So it's very good to pick and choose who, and it may just be a false, test. And if they scared you, then it will lead into even something else. So we're going to continue to acknowledge people, and there are other questions that we need to look into. So there's a question from Auntie Gertrude Jimmer. She says, please, if a lump is not cancerous, what can be done to help?
If a lump is not cancerous, so it depends on how long the lump has been there. But usually, if it's not cancerous, what we usually do is watch for signs of progression to malignancy or things like that. Because there are some women who have a lump from a younger age, and that lump gets bigger during their time of their menses, and then reduces in size after their period is over. So those ones are benign lumps, and usually we don't worry very much about those because they have a very low chance to develop into like cancer. So if the cancer aspect has been ruled out of the lump, then what we do is just watchful waiting, pretty much. Just keep your screening up and things like that to watch for signs of like it reverting in the cycle of like the cell development.
Okay. Did you want to add something to that?
I was gonna say, usually when anything in the breast, because of the nature of our breast tissue, feels like a lump, right? But not really. Just because it feels like a lump does not mean that it's a lump or that it's a tumor. So it could be a cyst, and if it's a cyst, then we can just aspirate it, basically take it out of there. So it's really important for us not to think that, whenever we feel something in the breast, that it is necessarily a lump. Like we were saying earlier in terms of, breast tissue. Some women have, more younger women have more dense breast tissue. So just because your breast felt a certain way at one point in time and now it feels this way does not necessarily mean that it's a lump. So everything you palpate or everything you can touching your breast, even though it feels like a lump because of where it is on your body. It doesn't necessarily mean that it's, either a benign tumor or, an atypical tumor. It could just be a cyst that can just be aspirated or taken out, basically.
And what you're saying is just the thing that prevents people from getting the help is the first notion is this is not good. This is something. So we kind of magnify it and make it bigger than what it is. So it's the fear. But we need to just own the fear and just say, I need to be informed. And the information is, then we begin to do the fight. And because we are more even spiritual people, we do know that we have the medical help that we need and we have God backing us. But the fear factor is what is gripping a lot of people from even initiating the help that they need. So let's also look into the family support because of the secrecy. We said that sometimes even when you go for a routine physical, there are some questions that you're asked that you don't know because people don't share with you. So what do you recommend if you are in a family and you have such a diagnosis? Is it much better? Because I know the research is saying one thing, but from experience, what would you recommend? Is it better to share so you can have the whole family rally behind you?
I would say, and I would go back to knowing who those family members are, right? So I think that in terms of, let's say, a mother that has been diagnosed with breast cancer, letting your children know so that they know that there is that family history, it's important because, and, in talking about this whole presentation, we're talking about how it's more so important for us, from with our backgrounds, because our mothers really didn't get that. The older generation might not know so much about their family history, and that has kind of passed down to us, right? So it's important from the aspect of so that your children know their medical history, especially, let's say, if your mother, you're being diagnosed at the age of 35, 40, that is very young. So passing that information out for medical reasons is very important. But then if you're telling it in terms of having support as you're going through the process, it's really important to still be picky and choosy in who you're telling and when you're telling it to them. So, you can tell them, I still think that it's important to pick someone who can stand with you in faith and can stand with you in prayer. And then if later on you want to share it, as time goes on, depending on, what is going on, is it progressing? What is the prognosis, things like that. But I think that initially, you don't necessarily have to tell your entire family, but telling, family members, or even if you don't have family members at that time, someone who can stand with you, if it's your church family, stand with you in prayer, stand with you and encourage you, stand with you in faith. And then, as time goes on, sharing it to maybe for medical reasons. So not sharing just to share. I just really have a problem with that. So it depends, just asking yourself, why am I sharing this? Am I sharing it, for pity? Am I sharing it so somebody can be, just as anxious with me? Or am I sharing it because I'm so anxious, I'm so afraid right now, and I need someone to just speak faith into my life?
Yeah. I think I can't stress enough the importance of sharing, I guess, the different diagnoses that you have as a family. Like, it's very, very important. Like, it doesn't even have to just do with like cancer per se, but high blood pressure, diabetes, like all these things are very important. And I feel like as a culture, or our background, we usually don't share things like that. So as a family unit, it's very important for a mother and a father, like once their children get of age, to discuss, hey, this is what's going on in our family. These are different things that we suffer from, or your grandma passed away from this, because sometimes we don't even know what is ailing us specifically. But since we are here, I mean, I guess in the state, it that's something that as providers go off of a lot of the time. Like, we always ask, what's your family history? Because it's very, very important for us in the diagnosis process that we go through. Like, because if your general diagnosis of breast cancer could be complicated, right, by your high blood pressure, could be complicated by your diabetes. So these are all things that I think is beneficial to know. And I can't stress that enough. Like, parents, talk to your children, grandparents, talk to your children as well, just to let them know, like, okay, these are the things that I've been diagnosed with, and this is what's going on. So, yeah.
We have Michelle also too is watching too. God bless you. And we have Anita Duasari, God bless you. And Rachel Aquay, Mrs. God bless you. And Alma Foster also says, I'm moving around and I'm listening. God bless you all. And those who are tuning and listening to us, we thank you for being in. Of course, my sweetheart is here. Elder Sam, God bless you also. So please, we are back to you if you wanted to finish. We lost you a little bit there.
Oh, you did. What was the last thing?
Yeah, so I think that we were talking about the secrecy in our culture, where everything is kept secret, and a lot of people have family risk factors that they are not aware of, so they go to the physician and they check no, no, no. Meanwhile, they have these things in their family, so that's what we're talking about.
Yeah, I think, I was just stressing because it's like one of my passions, like, for us to actually know our history, because if we know where we come from, then we know where we're going, right? So, I just want to stress like the family history aspect, in terms of being open about what is ailing you as a family. And in terms of exchanging things with your children.
Wonderful. All right. So let's look at dealing with specialists or insurance issues. So the people that are insured, the people that are uninsured, we sometimes some people feel like, well, I'm not insured, so what happens? But well, what do we need to know? How do we navigate the system? If I'm having any issues with my insurance concerning my care, who do I turn to? All these things if I'm already diagnosed or if I'm about to be screened.
I think so it's really important for our patients to know that just because you do not have insurance does not mean that when your doctor recommends that screening, you just brush it off, because, the first thing that comes to your mind is, well, a mammogram it's expensive, I can't afford it. So it's really important to know that there are a lot of programs out there that are tailored to patients that do not have insurance, patients that would otherwise maybe not even be able to cover the out-of-pocket costs, right? So it's really important to let your doctor know or let your providers know what some of these roadblocks are to you. So if it's a financial issue, really communicating it with them and letting them know. They might even be, like a charity out there that they work with or that one of their patients has used in the past. Hospital systems, depending on, if your provider is connected to, a hospital system, might have social workers that can help you navigate all of that. So it's really important in being open and not just thinking that just because you do not have insurance, just because you do not have the financial means, that it means that you are in it alone and that you're going to have to suffer alone, and that you're just going to have to die from the disease. So definitely from the get-go, being an advocate for yourself, and just making sure that you're not just putting it on the back burner and just forgetting about it for financial reasons. I think that's very important.
Yeah,
That's
and
good information.
So I've been doing some research into, well, the community medicine as far as like New York in general. But I'm sure every state has like designated groups that work with uninsured people. Um, and in New York, there's actually a lot of community services that will go as far as to provide you with free insurance that you can go and see someone to get screened. If you don't have the means to pay, they will also provide you with that. So there's a lot of like community services, and there's a lot of information and a lot of resources out there and that are just waiting to be tapped into, because those programs, in order to sustain themselves, they need people to tap into those resources. So if they don't have people going into those things, then we're losing those free resources. So these are all things that and you don't even have to be like documented. Like if you are having problem with documentation, that's also something that is a free resource that is out there that you could also get free healthcare as well. So there's a lot of things out there, and it all. I mean, all you have to do is ask.
Yeah, that's good to know, because sometimes that's the main thing. It's like, oh, I don't have insurance, so it's not going to be something that you want to even think about, because how can I afford it? But it's good to know that all these resources are available in the community. So it's good for us to know. So also, what are some of the hospitals that, so like, is there specific hospitals that you need to gravitate towards if you are diagnosed, or just, let's look into that.
Um, I don't know, not necessarily. There's not a particular hospital that uh, you would go to. So it all starts in your regular doctor's office. So that's something that I also want to stress. Don't go like you see a lump in your breast and you automatically go to the specialist, because that also increases your medical bills, right? Because it's something that you maybe didn't need to see a specialist for. So it all begins in your uh, provider's office, your PCP's office. So you go in, you say, hey, this is what's going on. And then they will put you through the proper channels, because they are there to be your first point of contact into the healthcare system. They are there to be your advocate. But if you jump the hoops and go straight to the specialist, sometimes they will not be your advocate. So that's also a thing. So
yeah. Yeah, and I will add that even if, let's say, your initial provider has been your point of contact, but then, let's say it has progressed, you have been referred to a specialist, and this, they're recommending one or other thing that maybe you might not be comfortable with. I always tell patients, if, let's say, your provider refers you to a specialist and you might not necessarily, let's say for one reason or another, agree with what they might be proposing or what their recommendations might be, go back to that initial point of contact. Let your provider know that, hey, I went to see so-and-so person that you referred me to. This is what they might have said. What do you think? Or, I might not necessarily agree. Can I get a second opinion? So knowing that you have that chance at a second opinion, if for any reason that you might not agree with that initial person, go back to that first point of contact, that, or the provider you've been seeing for years and years, asking them what they think about it. If there's another route that you could take, another person that they might refer you to, or even if it's for them to say, let's talk about it. I actually agree with what this person said, and this is why they may have said that. Because I think a lot of times patients disagree, not having all the facts or not having, all of the research behind why a provider may have, recommended one thing or another. So I think that is very important. Not, just because you've been referred to a specialist does not mean that, now you don't have to go back to that initial person, but making sure that you keep them in the loop as well. And then if at any point in time something goes wrong, at whatever point in the channel you may be in, coming back to that initial person and letting them know, hey, this is what happened. How can you reroute me?
It's good to know. We have other people who have joined us. We have Nana Yao Tia is watching. God bless you. We have one of our first ladies, also Mami Martha Dumbe is watching. God bless you. One of our deacons, Fidelis Graham Mensa, with me here in PRWC, is also watching. And Raleigh, presiding Elder Kobe Jemfi is also watching. God bless you all. Thank you for tuning in with us. So this has been very great, very interesting, and it seems that right just like that, 1 hour is here with us. So we're about to wrap up. So I'm gonna give both of you an opportunity to give us, final words, because we have said that the fear is keeping a lot of people from just seeking the help. So just as we are closing, what do you want us to know when it comes to breast cancer?
I think that of most important to me today, especially as we're approaching October, is Breast Cancer Awareness Month, right? So with awareness goes prevention. So getting that screening when you need to get that screening, not putting it off. We understand as your medical providers that the mammogram is not comfortable.
It is
But
not.
but there's a reason why it's recommended, right? So years of research has gone into it. The statistics shows that that it can prevent the cancerous cells, from can help with early diagnosis and things like that. So getting that screening, keeping up with your annual visits, things like that. So for me today, it's all about prevention, prevention, prevention. Stay on top of it, and just have it detected early. That's what I will leave us with today.
Thank you so much for joining us. Mrs. Priscilla Mensah, what are your closing remarks for us?
So for me, I mean, yeah, as if say said, prevention, prevention, prevention. Also, another thing I would add is know your body as a woman. Know it, know it, know it, because no one's gonna know it better than you. And you are the one who's gonna notice those changes that are happening in your body. And I can't stress enough, the screening, get it early, know how to do a breast exam. You can just do a quick Google search, although I don't recommend Google all the time.
Yeah.
Just for this one point, just how to correctly do a breast exam or self-exam, just for you to get to know your body better. And then, as we're going into October, just stay aware of the different prevention things and, get your wellness woman exam yearly as you're supposed to.
Yeah. And just one quick thing that I will add on to what Priscilla said. So, I would not recommend Google either. But, talking about going in to get your annual physicals, that is something that your doctor might do. So usually what I do in clinic is when I'm doing an annual visit, I will invite women to feel along with me. So if I feel something that feels abnormal, but it's normal, I will say, give me your hand, see how this feels versus this side of your breast. That's totally normal. This is what it is. So, not everybody practices different. So even if you don't know, asking your provider, that's why you're going in for those visits. So be an advocate, be involved in your care. Ask them, can you show me how to do an appropriate breast exam? How should I position my hand? Should I be laying down versus standing up? Things like that. And then just, you know, asking them to let you feel things as well. What are you feeling for? Can I feel too? And then, things like that. That is definitely, also very important. So being present when you go in for those visits and asking questions,
Yeah.
don't be afraid to ask questions.
Wonderful. So, Mrs. Priscilla Tutu-Mensah and Afua Acheampong, God bless you so much for being here with us on today's Woman. It's been very enlightening. And once again, this is the Church of Pentecost USA Radio, COPUSA Radio. Join us again on Monday for another interesting topic. And on Monday, we have a surprise for you. We are going to have one of our high-profile COP women here with us. Do not miss this. God bless you and love to your families. Thank you so much. And thank all of you who joined us. I see somebody else who just joined us, Mr. Samuel, Christy Enima. Thank you all, those who are listening, those who are tuning. God bless you. And we're going to pray for those who have been diagnosed and those who are afraid. As we always do, we end with prayer. Father, we thank you. You are the God who heals our diseases. You said there is hope with the living. We thank you that we are living. We thank you for health issues that are out there concerning breast cancer, that you are a healer. You will heal them. Those who are going through all the processes, that you grant them the strength, and at the end of the day, you will heal. May you continue to deliver us from diseases and sicknesses and heal us. We thank you in Jesus' name. Amen.
Amen.
God
Amen.
bless you and have
God
a
bless
blessed day.
God
you.
bless you
And
too.
Elder
Thank you.
Sam, God bless you. This is the Church of Pentecost USA Radio, today's woman. See you next week on Monday at 3 p.m. Eastern Time. Bye bye.
Bye.
Bye.